I'm Alexander Lee, and this is my presentation on the COVID-19 pandemic's effects on adolescent mental health. The COVID-19 pandemic has taken a toll on society. For over 1 year, schools were conducted online, and people were encouraged to stay home to prevent the spread of COVID-19. The official death toll in the United States for patients that died of COVID-19 is currently at 1.04 million. However, the true number is likely to be much higher. People that have died of other causes resulting from COVID-19 are not recorded in the statistic. This talk will focus on the mental health effects of the COVID-19 pandemic on children and adolescents. I would like to first present to you a case seen in clinic. A 16-year-old female is presented to the clinic with vomiting every morning for the past year. She is able to eat lunch and dinner without any vomiting. She denies any abdominal pain, fever, diarrhea, or unexpected weight loss. The patient is a high school junior active in high school marching band. She is healthy with no other medical problems and does not have any prior surgeries. Her family history consists of colon cancer and hypertension. The patient denies any alcohol or drug use. She is not on any medications and denies any medication allergies. Her vitals and physical exams are unremarkable. Her abdominal exam shows a normal, non-tender abdomen with no palpable masses. Upon further questioning, the patient states that she has problems sleeping at night, poor concentration, low energy, and feelings of sadness. She also feels anxious in the morning. Her symptoms are consistent with anxiety and depression. A diagnosis of depression is made when a patient has 4 or more of the following symptoms: poor sleep, loss of interest, feelings of guilt, low energy level, poor concentration, changing appetite, and feelings of sadness. Most likely, her anxiety and depression caused her daily vomiting. Prior to the COVID-19 pandemic, she did not have any of these symptoms and did not have any eating issues. There has been a dramatic increase in anxiety and depression among children and adolescents. According to a meta-analysis study in the journal American Medical Association Pediatrics, published in August of 2021, the global prevalence of depressive and anxiety symptoms in children and adolescents during COVID-19 was 25.5% and 20.5% respectively. The prevalence rates were much higher when collected later in the pandemic in older adolescent girls. Those numbers are double pre-pandemic estimates of 12.9% and 11.6% for depressive and anxiety symptoms. These numbers are much higher in the United States. A survey published by the CDC in April 2021 showed that more than 40% of teenagers say that they struggle with persistent feelings of sadness and hopelessness. On December 7, 2021, United States Surgeon General Dr. Vivek Murthy announced an urgent need to address the nation's youth mental health crisis. He states, mental health challenges in children, adolescents, and young adults are real and widespread. Even before the pandemic, an alarming number of young people struggle with feelings of helplessness, depression, and thoughts of suicide, and rates have increased over the past decade. The COVID-19 pandemic further altered their experience at home, school, and in the community, and the effect on their mental health has been devastating. The future well-being of our country depends on how we support and invest in the next generation, especially in this moment as we work to protect the health of Americans in the face of a new variant. We also need to focus on how we can emerge stronger on the other side. This advisory shows us how we can all work together to step up for our children during this dual crisis. According to the UCLA Center for Health Policy Research, 45% of California youth ages 12 through 17 report struggling with mental health issues. Suicide rate for children between 10 to 18 years increased 20% between 2019 and 2020. In July of 2022, President Biden announced his administration would strengthen school-based mental health services by investing $1 billion over the next 5 years in mental health access at schools. He also encouraged governors to invest more in school-based mental health services. On August 1, 2022, Governor Gavin Newsom declared that California would invest $4.7 billion in mental health so that anyone under the age of 26 can have better access to mental health. Governor Gavin Newsom stated, California is stepping up to tackle the mental health crisis facing kids across the country. We're overhauling our mental health system with an unprecedented, all-of-the-above approach to connect families and the care and support their kids need to grow up healthier and stronger. In July, a nationwide suicide prevention line was launched. If anyone is in need, they can dial 988. This number is supposed to be easier for people to remember, as it mimics emergency number 911. Locally, the Walnut Valley School District offers Care Solace, a 24/7 live resource to assist individuals in finding local mental health related programs and counseling services. This service can be accessed online or by calling. Walnut High School also provides peer counseling to allow students to speak to trained peers. There is also professionally trained school psychologists available for students to speak to. However, accessing this type of health can be very difficult. There's still much stigmatism towards mental health ailments. People can be ashamed to speak about it. However, if you notice any classmates or friends with symptoms of anxiety or depression, you should encourage them to seek help.